Hey, Dr. Asha here.
Dr. Asha Shahjahan.
I'm the Director of Community Health at Beaumont Grosse Pointe.
And is a family medicine physician and medical director of community health.
About to get started with my day.
So you do test positive and you do have symptoms. Nothing has changed in terms of guidelines for that.
Because once you have COVID, a lot of times you can have long hauler syndrome and other things. So it's important that your doctor, your healthcare provider knows that you've had COVID.
People that are recovering, that have had COVID maybe 2 or 3 weeks ago, that are still having maybe a persistent cough or still having some fatigue.
So you want to make sure that it's at least a 3-layer surgical mask or an N95 or higher.
The best thing to do is that if you were exposed to COVID or if you've had symptoms of COVID, to not test right away with the at-home test, but wait until day 3 to 5 and test during that time, because you're more likely to have an accurate test.
2021, I've been seeing an increase in the number of people that are coming in with alcohol problems. Mostly it's younger women between the ages of 30 and 40 that are coming in saying that they're drinking every single day.
Up to 20,000 Americans have been hospitalized each year for carbon monoxide poisoning.
Oh my gosh, it's now we're going into 2022 and we still have so many cases of COVID. Like, what is going on? This thing is never ending.
We've been more stressed out. People have been at home. They haven't been very active. People have been eating differently than they normally do. Not going to their regular doctor's appointments as they would normally to get screened. And then alcohol consumption has been on the rise, which has also contributed to elevated blood pressure levels. If you feel like you're turning to alcohol to calm your nerves or to feel better, that's a warning sign. Normal blood pressure is actually 120/80. So unfortunately, during the pandemic, there's been about a 2-point change in the average blood pressure of both men and women. If they're able to stop drinking completely for a week and they do well, then I'm a little bit less concerned. For those that feel like after a week they get a little edgy, they feel more anxious, or they feel like they have to pick up a drink again, then I really consider that they should go to a rehab program.